Hi there, my name's Dr. Debbie Wake. I'm a consultant diabetologist in Scotland, academic with Edinburgh University, and I'm also CEO and co-founder of MyWay Digital Health, and I'll be talking a little bit about some of the work that they've supported. So today I'm going to talk to you a bit about diabetes and Ramadan digital education, and specifically talk about a programme that we developed over the last couple of years, and we're continuing to run as an annual programme. This is very much being developed in collaboration with a number of other partners, which are shown here, including NHS organisations, international organisations, both in Malaysia, in the Middle East, and of course the Diabetes and Ramadan International Alliance, who've been key in supporting this. So the background is that we know that healthcare professionals lack confidence and knowledge around management during Ramadan. There's a good published literature on that, and that patient understanding and self-management is also suboptimal. So we've aimed to try to develop some self-management and clinician-facing education to eventually result in safer fasting during Ramadan, and also take it as an opportunity to try to improve diabetes outcomes more generally. We know that online courses have demonstrated effective, accessible delivery of structured online education. And so we chose the format of a MOOC to deliver our course. Now, what is a MOOC? A MOOC is a massive online open course, and MOOCs, the concept of MOOCs was developed by MIT in the US, where they brought together hundreds, sometimes even thousands, even tens of thousands of people, all to come together to work their way through a course over a structured period of time. They're free, they're open, and they're free to end users. And the good thing about MOOCs is they completely democratize access, and also from a delivery point of view, they can be delivered at very low cost and in a scalable way. So we did a pilot MOOC in 2022, and we delivered this in Arabic, Malay, and English. It was one course we delivered, and we opened that course to any stakeholders, including healthcare professionals and patients. We then went through a period of review, and this was redeveloped by a multidisciplinary team and wider stakeholders, so that this year in 2023, we developed two separate versions of the course, one that was healthcare professional facing and one that was patient facing. We promoted these through various diabetes programmes and partners, social media, and in the UK, we even had some national television press for the programmes. We then delivered the programmes as a result as an online self-service course that was opened on the 7th of March, and it remained open during Ramadan right to the 24th of April. And in addition to the self-service material that people work their way through, we also did live webinar Q&A sessions. And again, these were delivered for patients in Arabic, Malay, and English. So there's three different sessions, but the healthcare professional facing courses were just in English. So this is basically the methods as I've described. The only other thing to really say is that we did an evaluation, which included usage analysis, mixed methods evaluation of both pre and post course user surveys, and I'll take you through some of that. So this is just some screenshots from the course. You can see here some of the styling that we used. The courses were built so that they could configure to be used on laptops, tablets, or mobile phones. And I don't expect you to read this slide, but I just wanted to briefly take you through some of the content. Now, on the left is the healthcare professional facing content, and on the right is the content for people living with diabetes. And what you can see is basically the content is very, very similar. So we covered pretty much the same content, but obviously in a slightly different way for healthcare professionals versus patients in terms of the detail and so on. But just to take you through some of that, the sort of things we covered were diabetes and health risks, determining risk levels, what are the risks, talking about other health conditions, talking about Ramadan and food choices, healthy eating during Ramadan, diet control for suhoor and iftar, Eid celebrations, weight management during Ramadan, how it can impact on weight, managing physical activity during Ramadan, safely exercising, diabetes medication during Ramadan, specific things relating to insulin management, glucose monitoring, hypoglycemia. So they were some of the key topics. And of course, a lot of this was taken from the guidelines developed by DAR, that we basically put into sort of live content. So just a few screenshots to share with you. You can see here we had lots of videos with patient stories or healthcare professionals, dietitians talking through aspects of Ramadan, physicians again talking through some of the medication aspects, a lot of content relating to diet. So you can see here a 10-day Ramadan meal planner, for example, and Salma, who I'm sure you'll hear from as part of the conference, helped develop a lot of this content, and in addition with other collaborators such as Nisak from Malaysia and so on, to make sure that we contextualised and culturalised it appropriately. We encourage people to set goals, and we also had a language switcher so that whenever you were on the platform, you could switch between English, Malay, and Arabic. And the reason for choosing those two languages was that MyWay Digital Health as a company are operational in the Middle East and operational in Malaysia. And we already had built good collaborations in those areas, so it felt like that was a good starting point. We would, of course, like to expand the language options going forward. So again, just some pages to show you what it looks like. People work through topics. At the end of each little section, there's some quizzes. Each section will have imagery, it will have videos with transcripts. This is just an example of a page on, what are the risks with fasting, and pages on diabetes and medication, more on the healthcare professional facing stuff, pages on hypoglycemia, diabetes and food groups, blood glucose monitoring, and you might recognise some of this imagery from the DAR guidelines. I mentioned quizzes, so we do have little quizzes all the way through it just to test people's knowledge. And this is just some of the quizzes on health risks, for example, diet choices, just to give you examples of those. There's also discussion boards. So every single page in the course, there was a discussion board, and we encouraged people to leave their comments, share their stories, and it meant that it was quite an interactive way of people sort of learning from each other. So there's a big peer learning aspect to this as well. And then we did the live Q&A webinars, and we used Zoom because it seemed to be the most accessible platform that people were familiar with. And as I mentioned, we did healthcare professional Q&A sessions with experts, and we did an Arabic, Malay, and English sessions for patients. And this was utilising experts, both physician, educator, dietitian experts, and others in countries, in countries specifically in the Middle East, in Malaysia, and in the UK to help deliver some of these sessions. So what did we get? We got about 1,571 registrants this year from 50 countries throughout the world. You can see here that the predominantly these came from the UK and the Middle East and Malaysia for the reasons that I've described. About 908 of these registrants started the course, and about 387 completed the course. So there was quite a significant drop-off in terms of overall completion. But I think we always accept with digital education that not everyone will necessarily want to go through every single topic on the course. So, having full completion isn't always the outcome that we have to look for. In terms of the results, 68% were healthcare professionals, and 40% of those were diabetes specialists, and 54% were from a Muslim background. In terms of pre-goals, they generally wanted to understand risk, improve confidence around glucose management, weight management, fasting, medication management. And amongst our people with diabetes, 50% had previously had Ramadan education, 62% found fasting difficult, and 43% felt unsupported during Ramadan. And the goals set by people with diabetes were generally around things like glucose management and fasting fasting and dieting. So just to drill into the results a little bit more, I mentioned about the completion rates, 100% completion rates here, but if we look at 60% completion, which is often taken as a target for digital education, accepting the fact that not everyone will want to review every bit of the course, we're up to about 50% when you look at 60% completion rates. The results, we did some baseline surveys, and then we repeated those surveys at the end. We had a healthcare professional survey and a patient survey. The healthcare professional survey looked at understanding, their people's on a Likert scale, where they could say strongly agree, right, which is in green here, down to strongly disagree in red. They had to agree with these statements around understanding principles of fasting during Ramadan, understanding how fasting can impact on diabetes control, understanding which patients are at high risk, feeling able to support people to make informed decisions, feeling confident in advising people how to manage their diabetes, and having the time to support people to best manage their diabetes. So these were the baseline responses, and the patients, we asked them to fill in a questionnaire around understanding and knowing enough about managing diabetes, being confident in their ability to manage their diabetes, and worrying about managing their diabetes. What was interesting was that non-Muslim healthcare professionals reported lower confidence and knowledge, and when we looked at pre and post responses for healthcare professionals, all of these improved post-course, which is great, and for the patients, the first two improved significantly, which was knowing enough and being confident in their ability. The one that didn't statistically improve was about the anxiety and the worrying about managing their diabetes during Ramadan. We also just did a quick survey at the end of the course just to see whether people found the course useful, easy to follow, whether they felt it improved their knowledge goals, whether they felt it was enhanced by sharing stories and that it had all the information that they would expect. And again, you can see here the green is strongly agree or agree. So the majority of the responses were very positive on that. And these are just some text-based responses as well of what people liked during the course, that they liked the presentation, they thought it was authoritative, that many patients felt that they would like a bit more in-depth knowledge around medication, hypomanagement, and so on, which we'll take from that. They liked the personal stories and the videos. Healthcare professionals did ask that they would like formal accreditation, so we will again look at that for next time. So finally, just to finish off, I think what we've shown is there's interest in Ramadan-focused diabetes education and a need for it, particularly amongst non-Muslim healthcare professionals. Sequential impact on clinical outcomes we can't really determine in this sort of study, but we've certainly found value in the peer support elements of this. What we did find is there was a drop-off from people registering to completing the course, and we need to look at how we can improve that. And also we did find there was a high pre-course Ramadan knowledge, suggesting that the cohort we're engaging with were probably already maybe a motivated cohort. So I think we need to think about how we can better access those individuals who would maybe benefit from this even more, those who maybe don't currently have an interest in Ramadan education but would benefit from it. So that's our summary. I'll leave you with this page. All I want to do is encourage you to maybe join us next year in 2024. We are very much a coalition of the willing, and we're always looking for new partners to join and help us both deliver this, develop it, and to join the courses. So if you want to know more information about that, please do get in touch. Many thanks.